I am Sam Makhoul. I am the Medical Director of the Clinical Research Department at Cartai. Many studies that have looked at patients who have undergone chronic stress or have suffered from depression related to many stressors, because you have sometimes patients who are depressed as a result of some chemical imbalance inside the brain without necessarily having any major stressors. And you have the other part of the population who undergoes a lot of stress in our workplace, at home, and so on and so forth. And the question was, can, for example, depression by itself result in increased risk of cancer? And the other question is, any stressors that are the usual stressors in life, when they exceed certain level, can they also predispose somebody who's not depressed necessarily to have cancer? And the answer to these two questions are a little bit different, I would say. We know very well that stress can undermine the immune system, and that's the physiological link between stress and cancer. We know very well that the immune system plays an important role in fighting cancer. And cancer cells, when they start, they express certain proteins that are foreign to our body, and that can be recognized by the immune system. And the immune system mounts a response against those cells that have the abnormal proteins. That can result from mutations, changes of the DNA, and so on. So when the immune system fails, that allows these cells to progress through the different processes that ultimately lead to cancer. Now, there are people we know now very well who have been on immunosuppressive therapy. They have higher incidence of cancers. It's established now. We have also situations where the immune system, because of some congenital defect or other things, doesn't work well, not because they're receiving immunosuppressive drugs, but their immune system has failed. And those guys also have higher incidence of cancer. I think we need to start as society to try to understand that stressors sometimes are under your control, and oftentimes they're not under your control. If you are working in an environment where there are a lot of stressors, or the environment is not healthy, we see that sometimes you have work environments that are not conducive to productive work without being completely stressed out. Let's start there. So these are things that we need to do as society. But on the individual level, and I always tell my patients, you cannot control what comes your way. You can control how you respond to it. And empowering every individual to do that comes through, first of all, self-awareness of what I can do, what I can change in my environment, what I can change also in me, how I respond to that. In that regard, I have noticed that many of my patients many patients, for example, I ask them, what is the most important thing for you that helps you relax? Some patients tell me prayers. I say, okay, then you need to pray. Some patients tell me meditation is my ways. I say, okay, then meditate. And the other patients tell me, if I go for a walk, or I jog, or I ride a bike, or I visit with friends. I empower the patients and give them permission to do all those things, but not only as a fortuitous events in their lives, to schedule it. The best way actually to miss something is not to plan to do it, not to make it integral part of your daily life. Once you make it a part, you come to work every day, you wake up, you wash, you dress yourself, and you wear shoes. I don't need to ask you to do that, right? I tell them. They say yes. Then part of it also, you have to plug in your schedule a time that you are going to do that activity that would allow you to relax and recollect your energy back into you. Doing that, in my opinion, is extremely important. Now, there are people who have suffered from real depression that need some support, and sometimes the support is going to be talking to their therapist or taking a medication. And when there is a possibility that I can help them with that myself, I feel that the situation is not very complicated and straightforward, and simple intervention in that regard can do the job. If like prescribing an antidepressant or anti-anxiety medication, I do that. But sometimes we need to resort also to using an expert, a therapist or psychiatrist, psychologist, and so on. So I think the intervention can go from things that the patients can do for themselves immediately, being mindful of the fact that if you do it the way that it should be done, and what you do, everything, you pay your taxes every month, right? They go out of your paycheck every month. That should be a part also of your schedule. You don't miss on it. It's your self-preservation and self-improvement activity that you need to be mindful of every single day.